Welcome to Module 1 of Medical Professionals Fluoroscopy course. This course consists of 7 modules. All topics required to sit for a fluoroscopy exam administered by the ARRT are covered here. This module covers topics related to patient care and management. Upon completion of this course, the learner will be able to explain the difference between verbal consent and informed consent and provide examples for each. Provide examples of methods used to educate patients about fluoroscopic examinations. Describe methods used to reduce patient radiation dose during fluoroscopy. List and explain the types of contrast media used in fluoroscopic procedures. List and explain methods used to store patient information and test results. And explain standards of care and scope of practice. And finally, to define HIPAA and explain the consequences of violating HIPAA. Specific topics covered in this module are understanding the various types of consent and how to identify which is appropriate, patient education and the role the radiographer plays, an introduction to patient dose reduction in fluoroscopy, though there is a separate module for this topic, various types of contrast media, both negative and positive contrast, patient information and computer informatics, along with standards of care and scope of practice. Our first topic is consent. We will discuss the difference between verbal consent and informed or written consent. We will discuss the components, or what is needed, for verbal and informed consent. We will discuss situations in which a patient is not able to give consent, when verbal consent is sufficient, when a patient can withdraw consent, and when it is appropriate to work under implied consent. Keep in mind that a patient gives consent to routine procedures upon admission to the hospital or when they register as an outpatient. This does not mean that we should not get verbal consent at the time of the procedure. And we must get informed consent anytime a procedure involving substantial risk or that is considered experimental is carried out. The greatest concern for healthcare institutions with regard to consent is lawsuits. Verbal consents, as we learn, do not require documentation. A patient can claim the procedure was not explained to them. However, the burden falls on the patient to support that claim. Informed consent requires very specific guidelines which must be followed. Successful litigation relates to the hospital not being compliant with the requirements of consent, which we will discuss. Implied consent is a bit trickier to navigate, so let's first learn more about verbal and informed consent. Verbal consent is undocumented, which means that the patient agrees to the test or procedure but does not have to sign anything. It is not required, but it is the professional thing to do. As it is harder to litigate over verbal consent, though it can be done. Verbal consent is very basic, but it is a good indication that the patient agrees to having the procedure done and that they understand it. This is particularly important in fluoroscopy because some procedures such as the esophagams, upper GIs, and barium enemas, are not invasive enough to require informed consent, but they do pose a chance of the patient's modesty being compromised and require good cooperation. So it is important to get proper verbal consent. A patient should always know who they are giving consent to. This can be a first name and a title. Also, the patient's identity must be verified to make sure the correct person is giving the consent. Next, the patient must be informed about what they are consenting to and must be given an explanation of that procedure or examination. We must verbally ask patients if they have any questions, not just assume that there are no questions if the patient does not speak up. All questions must be answered truthfully. And lastly, patients have the right to change their mind, no matter what stage the procedure is at. When patients come to us for radiographs, it is important that we build a cooperative rapport from the first moment of interaction. This will provide trust of the patient in their technologist. First, the technologist introduces themselves. It is important that the patient know who they are giving consent to. Second, the technologist must verify they have the correct patient. Patient verification must include 2 identifiers at a minimum. Some examples of these are name, date of birth, medical ID number, patient wristband. Here, the technologist asks for the name of the patient and checks the medical record number on their armband. The technologist has told the patient what examination or tests they are having done. This allows the patient to question the name of the exam if it does not match what the doctor had told the patient. Sometimes doctors or technologists use layman's terms with patients, and the other used a medical term. This will clear up any confusion or accusations that the wrong examination was performed. Lastly, the technologist will explain the procedure, along with any discomfort, side effects, or complications. Let's look at 2 examples of examinations being explained to the patient for verbal consent. Here is a bad example of verbal consent. The technologist did not introduce themselves, did not verify the patient's identity. She did not tell the patient what the examination would be and left no opportunity for the patient to ask any questions. This has left this patient unsure of how to respond. Now, let's look at a good example of verbal consent. Hi, I'm Beth. Your doctor ordered an upper GI today. For this exam, when the doctor comes in, I will have you stand and hold a cup of barium. Have you ever had barium before? The patient. No, I haven't. The technologist. Barium will help your internal structures show up on the x-rays. It is a bit chalky, but otherwise has little taste. The doctor may also ask you to take some water and little air crystals. It is important not to burp after you take these. The doctor will put the table down flat so that you will be lying down. We will have you drink at different times and move into different positions on the table. The exam will last about 20 minutes. Afterwards, when you get home, it is important to drink a lot of water so the barium moves through your system. It will be eliminated when you move your bowels. Do you have any questions? Patient: No, not at this point. You have explained this very well. There are various procedures done in radiography that involve informed consent. Informed consent is always required when patients are agreeing to a procedure which may carry more risk than other examinations. These procedures are more invasive and are done under fluoroscopy. Myelograms involve a needle being placed into the subarachnoid space and the introduction of contrast media into that space. Risks include infection, nerve damage, seizures, and even paralysis. Angiograms are an examination of any vessel in the body. These could be arteries, veins, or lymph vessels. Each type carries a different level of risk, but because all require accessing such vessels invasively, informed consent is required. Angiograms of arteries or arteriograms require the introduction of a catheter into an artery, which is advanced to the area of interest and pose the most risk of these type of examinations. Common risks associated with angiograms are infection, hematoma, hemorrhage, phlebitis, thrombosis, embolisms, and the risk associated with contrast being injected. Arthrograms are radiographic procedures involving joint spaces. This could be the hip, the wrist, the shoulder, the knee, or elbow, to name just a few. These procedures involve a needle being placed directly into the joint space and pose risks of nerve damage, tendon damage, infection, and inflammation. Similar to arthrograms are joint injections, which are done to help relieve inflammation and pain in a joint. These are performed in the same way, with the addition of a cortisone injection. Contrast may be used to determine that the needle is in the joint space. Lastly, we have biopsies. Many types of biopsies are done under fluoroscopy so that needle placement can be verified. These procedures may or may not be done under fluoroscopy, but an X-ray would be taken for needle placement. Similar to biopsies are drainages and needle aspirations. Risks include hemorrhage, infection, nerve damage, and hematoma. Lung biopsies also involve the potential risk for a collapsed lung or pneumothorax. Informed consent is a bit different. This is often referred to as informed written consent or just written consent. This is because this type of consent requires proof or verification of the consent. Hospitals will have a standardized consent form used throughout the organization with content approved by their medical board. It is the radiologist's responsibility to know which examinations require consent and which ones do not. This means failure to get consent ultimately falls on the radiologist or any physician performing the examination. Many times you will find that there are general guidelines to follow in a department. Oftentimes, the technologist is the person getting the consent. However, the physician or radiologist should ask to see the signed consent before they begin the procedure. Informed consent carries legal implications. Successful lawsuits are based on lack of compliance when obtaining informed consent. The guidelines for informed consent are as follows. Patients must receive a full explanation of the procedures, along with the risks and benefits. Patients must sign the consent form before sedation or anesthesia. A patient must be competent to sign an informed consent form. Competence is a legal term. A person is not competent if they are a minor, but even adults can be deemed incompetent due to mental incapacity. Only parents or legal guardians can sign for a minor. Only a legal guardian can sign for a mentally incompetent patient. When a consent form is given to a patient to sign, the entire form must be filled out. Any blank spaces that do not apply need to be marked NA. Only the name of the physician performing the procedure can be listed on the consent form. It is not acceptable to write Dr. Smith and or his associates. All conditions of the form must be met. For example, if the form allows for a parent to be present in the room during the procedure on a minor, consent is not valid if the parent is not permitted to stay in the room. The patient or their designee have the right to revoke consent verbally at any time during the procedure. This is part of the patient's Bill of Rights and is implied, even though they have signed a consent. A timeout is performed before any invasive procedures requiring informed consent and must be indicated on the consent form. During a timeout, all parties must agree that the procedure they are about to take part in is what was ordered by the patient's physician, and it involved the correct body part and side. In our example, the patient is scheduled for a cortisone injection in their left hip. The radiologist performing the injection and the technologist verify that the requisition they have matches the doctor's order. Then this is confirmed with the patient. Be careful not to use the word right, as it indicates a side of the body. Instead, use correct. Let's watch. Once all information is confirmed, the examination is explained by the radiologist and everyone signs the document. Informed consent must have at least one witness. This is usually the technologist or a nurse. Keep in mind that the patient has the right to withdraw consent at any time. If the procedure is too painful, if they are feeling ill, or for any other reason, the patient has the right to change their mind. This would be outlined in a standardized consent form. Let's summarize the differences between verbal and informed consent. A basic form of consent is verbal. It is not required, but is professional to obtain and helps to build trust and rapport with the patient. Informed consent is required for any procedure deemed to be invasive and or pose more risk than is associated with other procedures generally. Because verbal consent is not documented, it does not carry a heavy burden for providers in legal matters. A patient is considered to have agreed to a procedure when they register to have it carried out and participate in the process. By contrast, informed consent is documented. Litigation is successful when documentation is not compliant with standards. For informed consent to be valid, the patient must be competent. This means they must be of legal age, must not be sedated or under anesthesia, and must be mentally competent. Verbal consent does not need to meet these criteria. We will discuss the different kind of consent, implied consent, in a bit. The next two comparisons, explanation of risks and benefits, along with the opportunity for the patient to ask questions and providing the name of the person performing the procedure, have different requirements depending on the type of consent. With verbal consent, these things should be given to the patient. With informed consent, they are required. Lastly, both forms of consent given here can be revoked at any time in line with the patient's Bill of Rights. Implied consent is consent which is not expressly granted by a person, but rather implicitly granted by a person's actions and the facts and circumstances of a particular situation, or in some cases, by a person's silence or inaction. There are many examples of this, but in medicine, this usually applies to a life or death situation when the patient is not able to provide consent and there is no other family or guardian to make a decision. Patient education is very important for the types of exams we perform in fluoroscopy. This communication with the patient starts at the time of scheduling, when exam preparations are explained, and it continues until the patient leaves the radiology department with post-procedure instructions and, at all times, even past that point. Patient education can mean many different things. It is the role and responsibility of the technologist to provide the patient with information about the procedure being performed, any side effects to watch for, information about when and whom to follow up with, and providing any instructions related to self-care after the procedure. Patient education is important, and we cannot just assume the patient knows this information. For example, the patient we see here just had an esophagram. Without proper education, the patient may assume that if they do not hear from their doctor following the procedure, everything is fine. It just so happens that this patient's report was misplaced at the doctor's office, and the mass indicated a large cancerous mass in the distal esophagus. If the patient does not know to follow up with their physician, and the physician never notices a report was not given, things can go wrong. 6 months later, this patient was in far worse condition and showed up in the emergency room for a CT scan, which showed a large mass and metastasis to other organs. Had the technologist educated the patient about following up with their doctor, this could have been mitigated earlier. Another example relates to the use of barium. Barium is very chalky and does not contain much water. In addition, water is absorbed by the small bowel, leaving just the powder, which can clump in the intestines. Patients need to be educated about drinking extra water to help move the contrast through the digestive system. Without that education, patients can end up with a bowel obstruction. It is sad to say, but things like this happen more often than they should. Technologists should be competent in answering patients' questions about examinations they perform. If the technologist does not know the answer, they should not pretend or invent answers. The appropriate thing to do is say, "I will find out for you," and then find the answer. If the question is better directed to the patient's doctor, then the technologist should refer the patient to the doctor or to the appropriate person to answer the question. Technologists should always be truthful and respectful to patients' concerns. Alleviating patients' concerns contribute to successful exam procedures, mutual respect, and cooperation. Here we have 3 patients. Each has a question about the procedure they will have done. The first patient is scheduled for an arthrogram of the knee. The second patient is having a liver biopsy under fluoroscopy. This is a great response that shows the patient where the dose falls compared to other examinations without dismissing his concerns. It also gives the patient a sense of comfort to know the benefit is greater and that the dose will be recorded. The last patient shown here is having a barium enema. This can be an embarrassing exam. The technologist has just finished explaining the procedure to the patient. Let's see what she has to ask. This helps the patient to feel comforted and respected. It also tells the patient what to do and to communicate her needs to the staff. This rapport and respect allows the patient to be more cooperative. Because having some of these procedures can be a stressful event, it is best practice to have some informational pamphlets for patients to take home. It is important that patients follow post-procedural instructions, and if they forget something very important or don't remember what type of symptoms to watch for, it could lead to additional health issues. Take, for example, the barium enema. It is important that the patient drink plenty of fluids so that the thick barium does not become compacted in the bowel. It is also just as important to let the patient know that they may see white in their stool or a small amount of blood, but to notify their doctor immediately if they have a large amount of blood, if they become constipated, or if they have severe pain after the procedure. The technologist's role is to provide education to the patient about procedures, including prep, exam length, side effects that they may experience, and expectations of the patient and follow-up care. The technologist is also the first person to answer questions the patient may have about the prep, the procedure, or the follow-up care. The technologist should be honest with the patient, use general terms that the patient will understand, and verify understanding with the patient, and find answers for the patient if they are unable to answer themselves. The technologist should relay any concerns to the radiologist prior to the start of the procedure.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.